how do you compare the routine EEG in the ICU with the continuous EEG monitoring? Keeping in mind that in most places we don't have continuous EEG monitoring. How good is the routine EEG to detect seizures and other events in the ICU?
Yeah, so, well, the first thing I'd say is, for your point about 15% who have status, I just emphasize that is with us attempting to treat patients who have electrographic seizures, and therefore they may not go on to status. If we were not identifying the seizures and not treating them or not treating them till later, we might find a larger percentage had status epilepticus. So in a way, that's kind of the tip of the iceberg in terms of the incidence of status epilepticus. So we've looked at the timing of seizures, and I think across different cohorts and age groups, the first hour or two are definitely the highest risk period. About half of patients who are going to have seizures do so within the first 30 to 60 to 90 minutes. So I think the first lesson we've taken is even if you can't do very extended monitoring in everyone, there's a good yield to doing a briefer study, 30, 60, 90, at least a couple hours in a lot of patients, because you're going to have a decent yield in that. And also that it's important not just to hook up the EEG and walk away, but really looking at it in the initial couple hours to see if they're seizing to act on it is really important, because that's such a high yield period. But beyond that, another half of patients we don't pick up unless we do longer monitoring. And that tends to be about 1 to 2 days in most patient groups to get about 90 to 95% of patients. And then there's a small percentage that we'll seize later. These aren't stable patients. Their neurologic problems are fluctuating, the drugs they're on are fluctuating. So exactly when the time starts gets a little tricky. Is it when they get admitted, when things get worse or change substantially? Does that start another period of high risk that they should stay on monitoring longer? But I would say for the majority of patients, we aim for about 1 to 2 days.